Joint pain that's debilitating? I feel your pain. In this video, I'm going to show you why your current treatment will not work, why medications and surgery are not helping and possibly making you worse, and most importantly, what can you do about it? My name is Dr. Drew Anthony, and by the time I was 25, I had 9 knee surgeries. I was told never to perform strenuous activity and that I would need a total knee replacement by age 40. I had the opportunity to play college football for Northern Arizona University. While playing, I injured my knees that required surgery. With the injuries, surgery, and daily pounding, my knees developed arthritis. I had to drain fluid from my knees, cortisone injections, hyaluronic acid injections, physical therapy, even ozone injections. I would only receive temporary relief, but my knees progressively worsening. I would have horrible aching if I sat or stood for a long period of time. If I performed any activity, my pain would be extremely debilitating for weeks at a time. I could not even get on the ground to play with my daughters, take walks with my wife, or exercise, which I really enjoyed. I got to the point where I was taking Percocet just to make it through the day. I became depressed, frustrated, and withdrawn. I decided to go through the process to have another surgery, waiting for hours to be evaluated by the surgeon, getting x-rays of my knees, being referred out for an MRI, which their first available appointment was 3 months out, and finally be able to schedule the surgery. 8 months from when I started this process. Now I knew the surgery would not fix my knees, but I was hopeful that I would achieve some level of relief. My knees worsened and I was frustrated, but really scared about my future. This is why I dedicated my career to find a solution, not only for myself, but to help others regain their health and quality of life. I have since learned the best possible treatment approaches to improve and even alleviate joint pain. Just like me, most people go to their doctor's office, get routine x-rays, MRIs, get some anti-inflammatory medications, maybe receive some knee injections, and get sent off to physical therapy. When that fails, you finally get that surgical consult and get set up for surgery. The surgery may provide some relief, but it increases arthritis. Once the arthritis progresses, you're told that the only option is to have a joint replacement. These treatment approaches are aimed to reduce inflammation or remove damaged tissue. However, the knee dysfunction remains, resulting in the progression of the problem. Most clinicians are asking the wrong question. They're asking, how can we reduce inflammation and slow arthritic changes? This leaves you continuing to be treated exactly the same and potentially leaving you to get worse. You could stay on this path, or you can get the needed treatment that helps your joint heal. So no matter what you have been told or how many treatments you have tried to no avail, you can get relief and possibly get your life back. In fact, I have helped many patients like you, including myself. I now am able to exercise, run. I even completed my first Olympic triathlon, and I'm currently training to complete a full Ironman triathlon in November. I now run 20 miles, swim 5 miles, and ride my road bike 100 miles per week. The best part is that my pain does not worsen after the activities. I'm now 43-year-old and do not plan on having a knee replacement at all. Many of my patients have had similar or better results. They exercise regularly, walk their dog, play with their grandchildren, vacation, and live their lives normally. So I put together a webinar which dives deep into how all of this works. You will learn the strategies that we use with our patients, what they do and how they work. I know this can sound too good to be true, or you might be even a bit skeptical about all of this. I totally understand. But if all you learned was one element that helped you reduce your joint pain, would that be worth it? So click the link, enter the details, and check out the webinar. However, a word of caution. This is not about losing weight or a new exercise regimen, a new stretch, or a new surgery, not another type of pill, potion, or lotion. This treatment is derived from evidence-based research science that big pharma and current healthcare professionals don't want you to know because you are way too valuable as a lifetime customer. So if you are happy with your current treatment approach, this is not for you. On the other hand, If you dream of a day where you no longer have pain, performing activities without paying for it, and reducing your chances of surgical interventions, you will want to watch. So click the link below, enter your email, and get immediate access to our webinar. I'm aware that most people do not have debilitating symptoms, so a lot of times it's hard to make changes that are needed to get healthy. If that is you, I get it. I personally was there and I have seen it with others in my office. But 99% of people do have a plethora of medications that they take which carry a bunch of detrimental side effects. But if you ask me or others that suffered with debilitating joint pain, they typically don't start out that way and have minimal symptoms in the beginning. So let me ask you this. How much longer are you willing to endure all of that? Are you willing to take a chance of it progressing? If you don't want to continue on the same path, you need to take action. So click the link and let us help you.